Good afternoon, my name is Dr. Cosentino. I'm here with Dr. Tsay from Aegis MD. He's a physician, a cosmetic physician actually from Orange County. And we're going to talk a little bit about some of the different procedures that Dr. Tsay does in his office, and also a little bit about Empire Medical Training and what we're doing differently with our programs and what we're going to be doing exciting for 2018. So Dr. Tsay, maybe, I know you do so many different things in your office. You just showed me a whole list of different procedures. Maybe if you could just tell me a little bit about one or two of the more popular or some of the procedures that are in the highest demand.
Sure. Yeah, I do a lot of procedures, mostly the non-invasive cosmetic procedures. Probably one of my most bread and butter procedures would be the liquid facelift. That's using neurotoxins, neuromodulators, along with fillers to give a lift to the face, a non-surgical facelift, as you would call it. And we do a variety of lasers, but probably one of the hottest lasers right now is the female rejuvenation or the vaginal rejuvenation laser.
Okay, yeah. Nice. And getting back to the liquid facelift, so we've all heard that, but I know that there's a lot of technique that you have to use to make this an effective procedure. Correct. And I guess your patients know that that's something that you do, and
they know that that's something that I specialize in. Correct. And it comes down to not just the technique, but then even which products you use. There's certain products that have a high G prime that lift and pull versus the softer fillers that don't do anything, that can blend in smooth lines and wrinkles. So you got to use the right product with the right technique.
Yes, okay. And then also, so the other procedure you said, the vaginal rejuvenation. And you've been doing that for a while now?
Yes, it's very popular. I want to say that it's a little tricky because you don't want to talk about it openly. It's not something that you just say in public, but if you poll a lot of women, they're very, very interested in it.
Yeah.
And if they talk about it behind closed doors, there's tons of women that want to do this procedure, but they don't want to talk about it, but they want it.
Yep, and I know it's very effective, so through our programs, and of course we're calling on you to do a lot of the training, for some of these techniques, either the vaginal rejuvenation, some of the others, but we're excited, of course, 2018, we're doing a lot of new things in our training programs. We're teaching, of course, in vaginal rejuvenation. We're always adding new levels of injectable training. So, of course, we have the entry level, the botulinum toxin level 1, level 2, but we're constantly adding new levels of training so that doctors are exposed to, like what you had just said, the liquid facelift. That's something important. We want our doctors, we want our members to learn these very detail-oriented, very labor-intensive type procedures so that they get good at it. So that's something that we're doing, for 2018, that we have some of these new procedures. Also, what's really big for next year is our Meet the Expert series, and that's actually why what you're doing here with us now. We're having one of these events right now, and this is where we work pretty closely with you. We work pretty closely with the doctors. We invite these experts in, and they're working with our students and our physicians, and they're teaching them, these different procedures. So it's pretty exciting. We're looking forward to work with you in 2018 and doing all these things.
Sure. One of the things that I noticed on your syllabus that is gaining popularity is a PDA Threadless.
Oh,
I do those in my practice,
yes,
but you guys are now offering, that's one of the newest, kind of latest and greatest. It's very popular now.
Because think about it, all these people that want to have a facelift, because that's the non-surgical facelift. So everybody that's coming, looking for a facelift, it's now the non-surgical replacement.
Right. I don't know if you know this, but the number of facelifts have actually declined year over year in the last 5 years. And I think it's because of the liquid facelift, the PDA facelift, the thread lift, all these non-surgical options that people have now.
Yeah, that's so true. So we have courses right now, and you're one of our teachers actually, right, for the thread lift. So it's going to be good for 2018. We're going to continue doing more of that.